Hi, I'm Dr. Mark Peterson. I'd like to thank you for viewing in, and we're going to cover a little bit of pulsed magnetic therapy today. Not too many people are familiar with this type of therapy. I'd like to give you a general overview of what it is and how it works. So with pulsed magnetic therapy, the general understanding of how it works is this. All of the organs in our body are made up of cells. We have over 75 trillion cells in our body. And if we look at the basic structure of the cell, and know that if we have a healthy cell, healthy cells make healthy organs make healthy systems, and healthy systems make a healthy body. So if we go down to the base structure and we look at that cell, and the cells in our body all have a certain electrical charge on this outer membrane of the cell. And in a healthy functioning cell, that is minus 20 to minus 25 millivolts. At that charge, the receptors on that cell, which are the doorways in and out of the cell, just like if you were walking in a room, you go through a doorway, and to get in you have to go into the door, and to get out you got to go through the door. For our cells, for things like nutrients, to get into our cells, they have to go through these receptor doorways. And for the metabolites or the toxic byproducts, those toxins inside the cell, they have to go out. When a healthy cell is at this electrical charge, these receptor sites open and close very easily, the way they were designed to. When a cell becomes damaged, these damaged cells have a membrane potential of around minus 10 millivolts. And I always tell patients, think about this minus sign here as an electron. It's the energy. It's the energy to do the work of moving those nutrients in and out and the toxins out of the cell. With the therapy, pulsed magnetic therapy, if you Google it online, you're going to want to look up PEMF, which is pulsed electromagnetic frequency, PEMF. Pulsed magnetic therapy, this has the capability of literally recharging the cell, pushing that damaged cell up towards that healthy electrical charge. And what does that do? It allows more nutrients in, more toxins out. You get better function of the cell. You get better, faster healing. And it has the ability to work on anywhere in the body because our entire body is made up of cells. So in the clinic, what does it actually look like? If we take a look at the unit itself, this is the MagnaCharger Pro here. This is developed, designed, and produced by a company called Pulsed Power Tech. And if you Google that online, or you can go to pulsedpowertech.com and look up the MagnaCharger Pro. This has the capability to attach both to a therapy chair. This would be something that we may use for disc problems or sciatic pain, and the entire mat is doing the pulsed magnetic therapy on the body. At other times, we may want to work specifically at a specific site. Maybe we want the shoulder, and we would use the therapy paddles. With the therapy paddles, we either stack them over an area or what we call sandwich across an area. And when the patient is doing the therapy, you'll actually feel the pulsed magnetic therapy moving through the tissues. We can do these on organs as well. I use this on gastric reflux problems. We use them on patients with elevated liver enzymes. We can sandwich the liver area and work that. I don't have them right in front of me, but we have a set of which are contoured to fit comfortably right around the thyroid. So with patients with either hyper or hypothyroid problems, it's worked beautifully. Again, you need to think about the base concept. If we can get a healthier functioning cell, we can get a healthier functioning organ, a healthier functioning system, and a healthier functioning body.